This storybook takes you step by step through the life-saving process of CPR. Cardiopulmonary resuscitation techniques were developed in the 1950s and have improved with careful statistical and clinical research to its present form. The American Heart Association produces programs for the layperson and the healthcare professional. Rachel Allison is a certified instructor who teaches children, adults, and professionals these vital skills. Your instructor is a registered nurse turned middle school teacher. Educating 6th through 8th graders and numerous opportunities available in the healthcare field includes many practical skills as well. This storybook tutorial utilizes 7th and 8th graders who have completed the American Heart Association Heart Saver course. Upon completion of this instructional storybook, you should understand the components of CPR, how to employ them correctly, and the correct order in which to utilize them. The need to utilize CPR may occur at any time and any place. Securing a safe environment is the first step. Checking the victim for responsiveness is the next step in the protocol. Assess consciousness by tapping on the shoulder and shouting, "Are you okay?" If the victim does not respond by moving, talking, or groaning, then assume they need medical attention. If others are near, send someone to call 911 or the emergency response number for your location. Point and instruct someone specifically to do this. If alone and a phone is available, call 911 yourself. Be prepared to relay important information to the dispatcher, such as your location or other vital information. At the same time, it is preferable to send someone else to retrieve the AED. Speak and point to someone specifically. An AED is an automated external defibrillator, and they are located in many public places. They are specially programmed computers that can detect and analyze heart rhythms. They will deliver an electrical shock in order to restart the heart if necessary. The use of AEDs have increased the survival rate of victims suffering cardiac arrest. Using an AED as quickly as possible as part of the CPR protocol is very important. However, while an AED is being located and brought to the victim, compressions and artificial ventilation should be delivered. After the emergency medical system has been initiated and someone is retrieving an AED, assess the victim's breathing. If others are available to help, all these steps may be occurring simultaneously. The American Heart Association has found that initiating compressions as quickly as possible increases the victim's survival rate. To determine whether the victim is breathing, remove any clothing blocking a clear view of the chest and scan for breaths for 5 to 10 seconds. Sometimes, victim of cardiac arrest, a cessation of the heart beating will gasp, but this is not sufficient to oxygenate the body and must not be considered breathing. CPR consists of 3 major components. Chest compressions is the most important, and CPR is begun with compressions. Locating the proper location for hand placement precedes compressions. Place the heel of one hand in the middle of the chest between the nipples along the breastbone. Place the second hand on top and lock fingers. Additionally, the victim should be on a firm, flat surface so the heart is squeezed between the breastbone and the spinal column during compressions. Press straight down on the chest for at least 2 inches. Keeping the shoulders directly over the breastbone will aid in the rescuer's body weight to contribute to the compressions. The chest should be allowed to return to its normal position between each compression. The rate of compression should be maintained at 100 per minute. This rate equals 30 compressions in 18 seconds. The next component of CPR is delivering breaths. The acronym CAB is used to remember the order of the CPR steps. C stands for compression, A for airway, and B breaths. A victim's airway is often occluded by the tongue and other soft structures in the throat. The airway must be opened using the head tilt, chin lift procedure, pressing on the forehead and lifting the jawbone by placing the fingers on the jaw. Pinch the victim's nose while maintaining the head tilt, chin lift. Place your mouth over the victim's mouth and deliver 2 normal breaths lasting 1 second each. The entire process of delivering 2 breaths should take no longer than 10 seconds total. The best way to determine if your breaths are effective is to watch for the chest rise during ventilations. If the chest does not rise during the first breath, allow the head to return to its normal position and reattempt the head tilt, chin lift. Give the second breath. If the chest still does not rise, resume compressions. Do not interrupt compressions for more than 10 seconds. Continue compressions and breaths until the AED arrives. AEDs are easy to use and fully automated, so the most important step is to turn the AED on as soon as it arrives and follow the visual and auditory prompts. Plug in the pad connectors. Attach the pads to the victim's chest in accordance to the pictures on each pad. Because the human bodies are good conductors of electricity, no one may be touching the victim while the AED is delivering the heart rate or delivering the shock. It is best to say out loud, "Everyone clear." Sometimes there are others at the scene who also may be trained in CPR. If so, you should alternate the delivery of CPR every 2 minutes. Research shows that the first few compressions are the most effective, even if the rescuer is not feeling tired. Therefore, switching with another CPR provider every few minutes is recommended. While resting, encourage the other rescuer to push hard and fast, at least 2 inches deep. Maintain the ratio of 30 compressions to 2 breaths, and do not interrupt compressions for more than 10 seconds. Watching the chest rise during the breaths is the best way to know if the breaths are effective. CPR should be sustained until professional help arrives. It also may be suspended if the victim begins to breathe or responds.